Hello everyone and welcome to my channel. I am Dr. Noor Mustafa, a physical therapist, and today I am going to talk about a very important topic in medical education, which is medical English communication. It is basically an art of communicating in scientific language. As we know, communication is at the heart of effective healthcare, whether we are talking to patients, collaborating with colleagues, or documenting our findings. The way we use language shapes understanding, empathy, and trust. In this lecture, we will explore what medical communication really means, why medical terminology is essential, and how linguistic approach help us use scientific language accurately and confidently. By the end of this session, you will understand how to use medical terms correctly, explain diagnosis clearly, and enhance your professional communication skills, which are vital for quality patient care and teamwork in healthcare setting. So let's begin by looking what medical communication actually is. Medical communication skills is an integral part of education which affects the quality of health care provided in high stress environments such as emergency departments. It involves the exchange of information concerning health, illness, and treatment among healthcare providers and patients. It can take various forms, including verbal interactions like patient consultations and team meetings, writing documents, which includes patient records, research, articles, and digital communications like telemedicine, electronic health records. Medical communication has crucial part in healthcare to ensure high quality patient care and public health outcomes. However, healthcare professionals often face significant challenges when communicating with other healthcare providers, patients, their family members, and public. After this lecture, you will be able to learn, explain medical terms, discuss diagnosis, provide clear instructions, ability to actively listen and empathize with patients, communicate effectively with other healthcare professionals, foster teamwork for coordinated patient care. So what is medical terminology is? Medical terminology is specialized language used in healthcare to describe the human body, its function, and various medical conditions. Healthcare professionals who are proficient in medical terminology can communicate more accurately and efficiently with other healthcare professionals, reducing the risk of miscommunication and medical errors. They can document patient information precisely and thoroughly, which is very important for proper diagnosis and treatment. It also provides a standardized language that help ensure consistency in healthcare documentation, making it easier to share information between healthcare organizations. It can be used to create new words when new scientific discoveries occur. Learning medical terminology can be challenging for students, especially for medical students who are learning English as a second or foreign language. So, why do we use medical terminologies? Learning and using medical terminology is of utmost importance for the healthcare providers to deliver quality care and improve patient outcomes. to document patient information precisely and thoroughly, which is crucial for proper diagnosis and treatment. Medical terminologies can be categorized into four main sources. The first one is word parts that includes typically of Greek and Latin origins. Second one is eponyms, words formed from a person's name such as Parkinson's disease. Acronyms, terms derived from the first letter of word in a phrase, for example, PET scan. And the last one is modern language, terms derived from modern advances in technology such as nuclear medicine. It can also be standardized using consistent prefixes, suffixes, and roots to create terms that are universally understood in the medical community. The vocabulary is constantly evolving as new medical discoveries are made and new conditions are identified. In this module, you will learn basically four methods. The first one is linguistic method, second one is discovering patterns, third one is learning strategies training, and the last one is contextual analysis. Although there are several approaches to learn medical terminology, one is to break down medical terms into component parts such as prefixes, suffixes, and word roots. And the other approach is to use case studies and real world examples to gain knowledge of medical terminology in clinical settings. It can help you develop critical thinking skills and learn how to communicate effectively with patients and other healthcare professionals. So let's begin with the first approach, and it is a linguistic approach. It is an approach in medical terminologies that focus on the study of language and its structure as it applies to medical vocabulary. It emphasizes understanding how medical terms are formed, used, and interpreted within the healthcare context. Medical terminologies has its roots in both Greek and Latin languages, which have been used in the medical field for centuries. The meaning of many medical terms is derived from the roots, prefixes, and suffixes of these languages. A prefix is a word that is added at the beginning of a medical word to modify its meaning, usually indicating number, location, time, or status. For example, hyper for excessive. The word hyper is prefix that we use before any root or suffix. Now, what is root? The root is the basis of a medical word and provides its essential meaning that is basically used to connect root to suffix. For example, glyc for sugar. And the last one is suffix. It is a word that is added at the end of a medical word after the root to modify its meaning, usually indicating procedure, condition, disease, or disorder like anemia for the condition of that we use for the condition of blood. How can we make medical terminologies so different by combining root, suffix, and prefix in different manners? We can create medical terminologies. The first one is to add a suffix in root, root plus suffix. For example, cardioitis. Or we and the next is prefix plus root plus suffix. Example is epigastric. Third one is root plus suffix like otorhinolaryngology. And the last one is prefix plus root plus suffix. For example, electroencephalography. Here are some examples that will help you to understand. So let's begin with the prefixes. Like in scientific language, we use word epi, and in layman language, we use above. Infra for beneath, hypo for deficient, hyper for excessive, leuco for white, and zero for yellow. Next one is root, cephalo, and in layman language, we use a word head, pulmon for lung, heme for blood, hepat for liver, cardiac for heart, and nephro for kidney. And the last one is suffix. Ima is used for Ima is used in scientific language, and for the layman language, it is swelling. Oma for tumor, itis for inflammation, algia for pain, Tommy for inseam, and sclerosis for hardening. So that brings us to the end of our discussion on medical English communication first module topic. We learned how medical terminology provides a universal language for healthcare, making our communication more precise, professional, and patient centered. We also explored the linguistic roots, prefixes, suffixes, and suffixes that help us build and understand complex medical words easily. Remember, mastering medical communication isn't just about memorizing terms, it's about connecting meaningfully with patients, peers, and entire healthcare team. Thank you so much for watching. If you found this lecture helpful, please give it a thumbs up and subscribe to my channel and share it with your colleagues and students. You can also leave your questions on topics you have like me to cover next in comments below. Until next time, take care, keep learning, and keep communicating with clarity and compassion. Thank you.